and welcome to another episode of Health, Wealth, and Happiness. Thank you so much for joining us today. I'm your host, Jen Cohen. If it makes you healthy, wealthy, or happy, you will find it here on Health, Wealth, and Happiness. Today we're talking with Dr. Jack Huston from Camp Verde Eye Care. All things eye care. You need your eyes. That makes you happy. It makes you healthy. And of course, it makes you wealthy. It's a little easier when you can see.
It does, yes.
For sure. Jack, thank you for being here.
Yeah, you're welcome. I'm happy to be here.
Yeah, it's so important. Sight is such a gift, and it's something that we take for granted, I think, every day. You know, unless you've had some sort of injury or a history of something, you know, you go around every day looking at things and driving and reading and doing all these things, not thinking about how fragile and valuable that gift is. But you see it every day. You get it.
Yes, I do. Yeah, and the fact is that we do take many, many things for granted. I happened to fall and break my tibia, and I realize how much one little thing can make a big change in your life. So yeah, and the eye care, I'm seeing more and more of the macular degeneration and things like that. So it's kind of interesting getting into more and more of the field of medicine.
For sure.
Tell
us, go ahead.
Go ahead. No,
Tell us a little bit about yourself. How did you get into the field here?
Well, I had quit teaching high school math and science and had 3 little girls at home and was gone 5 days a week working out on the road, and decided I couldn't do that anymore, so I made a list of professions and started scratching them off. And I had been in photography too.
All right.
And so it kind of fit. And took my family to Indiana and went to 4 more years of college and said I'm not going back to Iowa and staying in Indiana, so I moved to Arizona for 1970.
All right.
I've been doing it since then.
Wow, that's impressive.
And I like it. You know, that's the nice part. I enjoy it a lot.
Absolutely.
And I can do things that I couldn't do at first, because ophthalmology and optometry kind of fought with each other about what we could do and couldn't do, and they tried to keep us from doing things. But now we can do all the things that an ophthalmologist can do, with the exception of surgeries. So it's fun.
Well, that's good. They've streamlined that process a little bit for us. And having been in business so long, I'm sure you've seen everything. Yeah,
being in business isn't really for everybody, that's for sure. I've said that the only thing more overrated than apple pie is owning your own business. But that has its rewards too. I've had some really fantastic help. I still do. And most of my help is now retired.
Oh, wow.
And I've got a bunch of young ladies that are really, really good.
Nice. Nice. And I know you're going strong. You're still keep working into the future, and there's retirement is not on the horizon for Jack.
Not at all.
Which really shows that you love what you do. You're passionate about it. You're good at it. You've got great clients. They speak highly of you. You know, a full caseload, so to speak, and that just says a lot about the quality of care that you give your patients.
Well, I tell people that my help makes me look good.
If you want more information about Camp Verde Eye Care, you can go to their website, cv-eyecare.com. You can give them a call at 928-567-3330. Now, you do a lot there. You soup to nuts. You do exams. You can help patients with ways of treatment. You can help patients discover things like degenerative eye disease or anything like that. But what do you see the most of right now? What are you doing the most of?
Well, a lot of it has to do with macular degeneration, which is coming on stronger and stronger. And we talk a lot about blue light, because people are sitting 5 days a week, 8 hours a day, staring at a computer. And I didn't hear anything about this until about 12 years ago, and I couldn't figure out what they were talking about. But fluorescent lights, LEDs, computer screens, televisions, tablets, cell phones, and the sun all put out this blue light. And like the lights we're having in here right now, they're pretty high, and it's called the Kelvin temperature. There's a lot of blue light in them. That's what makes the lights whiter. If you take a lot of, if you lower that Kelvin temperature, it's not as damaging to the eye. And it turns out that ultraviolet light we've always talked about, but the blue light is just as powerful, and it gets right through the cornea and the lens, where the ultraviolet's almost all filtered out. So we are now recommending vitamins, mineral supplements, it's called lutein and zeaxanthin. It's in your in your diet. If it's a thin layer of that, you don't have as much filtering capacity, and you're more likely to get a damage from macular degeneration. So we can even measure the density of that pigment, and then we have vitamins that will build it up. So we're trying to prevent now instead of treating afterwards. And especially if we see, we've even got a scanner that can scan your retina down to 5,000ths of a millimeter.
Wow.
It's like doing an MRI, and we can detect macular degeneration and things like that when it's almost not there yet.
Wow.
And those are the ones we really want to make sure that we are treating with things like this, so that hopefully they won't get serious problems from it.
Oh my gosh,
So
yeah, that
we're
is
in
something.
preventative now.
That's good. That's a good
Oh, yeah.
mode to be in. It's interesting how things have changed just in the past couple of years. I mean,
Yeah.
yes, we all stare at tablets and computer screens and our phones all day long, and we're learning about how damaging it is. So it's wonderful to get in and get care early if signs of damage start showing up, for sure. And the diagnosis of these things comes from an eye exam. First thing they got to do is get an eye exam, correct?
Yeah, and people think that when I'm asking the question about which lens is better, that's an eye exam. That's not really an eye exam. It's a glasses exam or a contact lens exam. The eye exam starts after that with the dilation of the eyes if necessary, for checking the intraocular pressure for glaucoma. We are actually screening everybody with a wellness screening on that device I told you about, which takes very little time, but everybody over 30 we're screening with that, and if we find something with that, then we get them back for the full scan and have a record of what level it is, and then every time we do it, it will tell us if there's any change. It'll pick up macular degeneration and damage from glaucoma that I couldn't tell any other way.
Wow.
So it's really valuable.
Technology has come a long way.
Yeah, and I only got that about 5.5 years ago, and I'm still learning about it.
Wow.
So.
Well, that's great that you have that at your disposal now.
It is. I'd hate to
huge.
practice without it now.
Yeah, you'd be practicing blind, basically.
Yes,
I guess you could say.
Yeah, I'm sure that we all missed a lot before that technology was there. The problem is the technology is very expensive, and they become obsolete very quickly. But it's still working great, and I'm really pleased I can do that.
Yeah.
I even had somebody the other day, and I looked at the scan. And before I went to see the patient, I hadn't looked at their history or anything. I went in and purposely asked, do you have diabetes? Because I could see on that scan, and I've only seen a couple like that one, but it was significant.
Wow.
But I saw from that scan, and I thought that's what it was, and yes, she had diabetes.
Wow.
So I can even sometimes pick that up where they might not even know it.
Right. Wow. That's amazing. As they say, the eyes are the window to the soul. They're the window to your health history now, with the way technology has increased and your diagnostic tools. Now, what's the difference between a comprehensive exam and a refractive exam?
Well, see, that's what I said. The refractive exam isn't really an eye exam. It's a glass. It's an examination to find out what you need for a prescription in your glasses or your contact lenses. It's interesting because people get all excited. Have you had your eyes examined? I shouldn't ask you that.
Many times.
People get all excited and worried that they're answering incorrectly. But I tell people the only reason I put the letters up there is when I listen to you read the letters, I can tell how blurred it is. I don't care if you get them right. It's not important, but everybody thinks it is. So if they read it, and they can tell me all day long how blurred it is. But I'll know precisely just by listening to them read the letters. And then when I'm showing you lenses, everybody thinks they need to answer it correctly. All I'm trying to do is find the two lenses you can't tell apart. I'm not even trying to make it clear. But nobody knows that.
Right.
So they get all worried.
How interesting. Yes. Better or worse? Better or worse? This one or this one?
Well, then they say, well, they're both terrible. I know. I want to know which one's worse.
Yes.
Yeah.
Exactly. But I've been through dozens and dozens and dozens upon of those. I've been wearing
I try to
glasses
explain
on,
that to people now that I'm slowing down a little bit and saying, listen, don't worry about this exam because I get paid for right answers. And if you don't like the glasses afterwards, that's my problem, not yours. So.
Wow, that's a nice way to.
So that's the refractive part. The other is, doing the pressure tests and all the screenings and things.
Sure, the glaucoma tests were the puff
I'm looking
of
at
the
cataracts. There's another thing people say. Don't have cataracts, do I? Well, you're 60 years old. Yes, you do, unless you had cataract surgery. Everybody does.
It's just something that happens.
It's just a gradual graying of the lens inside your eye. And it happens so slowly you don't know what's going on. I've had people that almost couldn't pass the driver's test, swore up and down they saw fine. But when I finally talked them into relaxing and getting cataract surgery, they didn't realize it was that bad.
Wow.
But it's, most of the time I have to talk them into it.
Well, sure. I bet. I can see people would be hesitant about a lot of things, you know.
Yeah.
They get scared easily.
I actually had a fellow come in the other day, and we can't mention names because of HIPAA, but he'd been a patient routinely. And he came in because he said he was driving over in Prescott, and all of a sudden his right eye went blind over this way, and he couldn't see out over there, and he still couldn't. And I started checking, and I got to thinking about it. So I checked both eyes. Well, both eyes were not seen over here. You know, he just thought it was the right eye because it was the right side. That was a sign of a stroke.
Oh dear.
And he was fine. He didn't feel bad or anything else. And I said, you need to talk to your physician.
Wow.
And he came back to the office a couple of days later. He said, I had a stroke. I'm really happy to find that out.
Wow.
So,
that's amazing how much you can tell from just looking at someone's eyes.
experience helps a lot.
Yes, you've had a lot of experience. Yeah. If you want to check them out, cveyecare.com, cv-eyecare.com for Camp Verde Eye Care. We're talking with Dr. Jack Huston. We've got more of a health, wealth, and happiness coming back at you, so don't go away.
Been hearing about the crazy benefits of CBD? Find out how CBD can help you at Sedona's #1 resource, CBD Sedona. Come in for a free consultation and let our trained medical staff help you find the perfect product for you. Pain-relieving salves, full-spectrum oils, honeys, teas, cookies, and even CBD for pets. Ready to feel fantastic? Come on by CBD Sedona today.
Parents, you know as well as I do, there's nothing more important than your children. Don't you love to look in their eyes and see the love? Make sure they can see that love in your eyes by having their eyes examined. You can't tell how well your kids see, but Dr. Huston at Camp Verde Eye Care certainly can. Call 567-3330 to make an appointment. You'll be glad you did. Camp Verde Eye Care at 567-3330. They really do care.
Northern Arizona Thermal Imaging uses a state-of-the-art medical digital camera to take a picture and create a map of the body's infrared patterns, later interpreted by an MD specially trained in reading thermography. Northern Arizona Thermal Imaging is the leading medical imaging and proactive healthcare, detecting early danger signs years before other tools, finding early breast disease up to 8 years before mammography may detect it. Schedule a scan with Carol today. Northern Arizona Thermal Imaging. Say yes to thermography. Metaphysics. What does it mean? It's a branch of philosophy, literally beyond the science of matter. Sedona's University of Metaphysics studies the ultimate nature of existence, reality, and experience. Join 14,000 graduates in over 120 countries, helping others in counseling, coaching, ministry, and much more. The University of Metaphysics is here to serve the best in you so you can serve the best in others. universityofmetaphysics.com.
Start your journey toward better health with Ageless Touches Massage Therapy. Licensed massage therapist Richard Stevens uses the latest and best equipment to relieve scar tissue, electronic smog, and tinnitus. Ageless Touches does everything they can to work your issues down to the bone. Improve your path to better health with Ageless Touches Massage.
Solid Rock Fitness is a one-on-one fitness studio specializing in fitness over 50. I train older adults of all fitness levels, from athletes and avid sports participants to folks with chronic pain to those recovering from surgeries. You and I will focus on strength training to improve overall muscle tone, core conditioning, balance, agility, flexibility, and nutrition. Mastery of these components of fitness will help you live your life to the fullest with confidence and competence.
Welcome back to Health, Wealth, and Happiness. We're talking with Dr. Jack Huston from Camp Verde Eye Care. We've been talking about all kinds of things, eyes related, and the things that he can discover just by looking in your eyes. And we were just discussing during the break the numbers of different eye diseases and disorders is like around 30 or so. And diagnosing them, as you say, has gotten a little bit easier because you have all this amazing equipment now at your disposal, all this technology behind you. But you're still always working to diagnose these things and still seeing these new things coming, yet still having the old things. We still have cataracts. We still have, corneas detaching and all kinds of things that you may not notice unless you go in and have someone look. So it's very important.
This is what people don't realize. They could, I'm seeing blurry, so we get an eye exam, and they think that when I'm doing the lenses, that's the eye exam. We talked about that before, that's the glasses exam. The fact is that there are so many things that I can detect for your whole physical well-being. Brain tumors. I've actually detected a couple of those. One lady, actually happened to be my mother. I had to make her let me examine her eyes. And she was 20/20, and I found no change in her prescription. I looked in her eye, and there was red flame-shaped hemorrhages and white woolly patches all over, and I said, "You've got some very high blood pressure." Oh, it's been a little high ever since I was born. I said, "It's not a little high, it's really high." Oh, it couldn't be because I feel good and I don't have a headache. Well, I called my wife and had her come and get her, take her to the doctor. It was 260 over 140. He threw her right in the emergency room. I went right into the coronary care unit. And I was up there a couple of days later, and I said, "You grab a scope and look in her eye now." It was back to normal. That's an extreme condition. I've only seen it twice in 49 years. That was that blatant, but I can look at the blood vessels and times tell people they probably ought to get their blood pressure checked. Corneal problems, contact lens patients don't realize that you can destroy your cornea with contact lenses. I've seen 2 people had to have corneal transplants because of them. And those are things that I deal with. And Graves' disease, people don't realize that the eyes can tell you something, but if they're bulging out, they may not have Graves' disease, but I've sent a couple people and told them to get their doctor and see them, and sure enough, they did have. And so there's a lot of different systemic conditions show up in the eye exam.
Wow.
And we deal with those on a daily basis. I told you about the one who thought he'd lost his vision on the right eye off one side. It turned out to be both. Wow. And it was a brain tumor. No, it was a stroke.
Right.
Yeah.
That's so amazing.
It's really it's the window to your soul. Really, actually, the eye is part of your brain. It is. There's no separation whatsoever.
Wow.
All from the same fetal tissue and everything.
Wow.
And actually, you see from clear back here.
Wow. Yeah, that's right. I know. I always thought that was fascinating in science and health when we would discuss that.
I also like to tell people that I know blind people with great vision because vision takes in all 5 senses. And you can tell a blind person, what's on the table right now because he can smell it. So
that is true.
But it's really, it's devastating to people who get macular degeneration because it destroys your central vision because it distorts your cornea or your retina. In that area where you look right at a letter. Imagine looking that far away from a letter and trying to read it. So if you got the central macular degeneration, you can't look at a spot and see any detail, so you have to look away from it.
Wow.
That's why it's so devastating, and why caught early, at least we can try to stop it from getting worse.
That's true. And treatments have come a long way now, too.
They have.
We're able to really treat people differently.
Well, we're also getting into the genetic field, where we can maybe see who is genetically predisposed and what type of different things that we should use for trying to treat it.
That's interesting. So if my grandmother experienced macular degeneration and a detached retina, that would leave me more predisposed.
It would. Same with glaucoma. It's about 6 times as likely to inherit that from your mother's side of the family.
Wow.
So there, and detached retinas. I found one young man about 25 years old came in for an eye exam, 20/20, no problem. Looked in his eye, and the whole nasal side of his right retina was pulled loose.
Oh dear.
He had no clue.
Oh dear.
So you get them off and have that repaired before the whole retinotory is loose and the eye's blind.
Craziness. Now these are very severe conditions, severe disorders.
Correct.
But there is something that most of us struggle with: dry eye. And you think of dry eye, no big deal. I put some drops in. This is not so. Let's talk about dry eye.
Yeah, the dry eye. The drops are. There's a problem with drops. There's a lot of difference in drops. There's one company. Well, there's a couple really good companies. One's Sustain, and the other I can't tell you right now. But they have at least probably 8 or 9 different drops and ointments and gel for dry eyes, each one for a different problem. And we now have a way we can test the osmolarity of your tears and tell if there's excess salt in the tears from the tears evaporating. because there's three things in your tears. There's water, oil, and mucus. The water is formed by a gland up here, and the mucus and oil in the glands in the lids. And if they're not there in the proper amount, then your eyes are going to dry out. And most people, as they get older, the glands in the lids that produce the oil deteriorate and get plugged up. And we can do some things about unplugging them, and with heat masks and some things like that. And then specify the different things that would, because you got to treat everybody differently depending on what's going on. But about 85% of it is the oil that isn't being produced. And the older you are, and women are more likely than men, and then certain medications can cause it too. But people come in and say, my eyes are really watering like crazy. Well, you've got dry eye. Well, wait a minute, they're watering like crazy. So we'll put these drops in. And the one fellow called me back about a week later and said, I don't understand this, but my eyes are not watering now. So it's not as simple as it sounds.
Right, certainly.
Just go get a drop off the shelf doesn't mean anything.
Right.
We also have something called hypochlorous acid that the body produces, which has been used for wound healing for a long time, that if there's some inflammation of the lids, we can use that on the lids and help stop some of that.
Wow. So dry eye is nothing to, well, we would say sneeze or blink about, really. It's an actual serious condition that you want to get checked out. There could be several reasons why you're experiencing it. Of course, quality of life is definitely reduced when you have dry eye. So that's something you want to deal with, and that's a common complaint of your patients.
Another problem with creating dry eyes is the computer, because, or reading a lot, because you don't blink when you're doing that. You don't realize it, but you're staring at that, and that's making your tear layer dry out.
Wow.
And then it starts to blur when you blink.
Right, that's true.
And people have to stop. So we took the 20-20-20 rule. Never, and this is very generous. Never read for more than 20 minutes before you stop, a minimum of 20 seconds. Do a minimum of 20 hard blinks while looking around the room.
Okay. 20-20-20. Remember that. If you want more information, go to cveyecare.com or give them a call at 928-567-3330. We'll be right back, so don't go away.
Regrow, repair, replace. Regenerative medicine is the process of creating living, functional tissues to repair or replace tissue or organ function lost due to age, disease, damage, or congenital defects. Dr. Forrest Lanchbury and the team at Sedona Regenerative Medicine specialize in finding relief for patients suffering from chronic pain. Contact Sedona Regenerative Medicine to learn about anti-aging medicines that will help your body heal itself. 928-282-2520 or SedonaRegen.com.
Award-winning Soundbites Grill is an entertainment restaurant located in Uptown Sedona at the Hyatt Pinion Point Resort. Open for lunch and dinner, featuring fresh fish, all-natural hand-cut beef, even a full vegan menu. Family-friendly, open 11:30 to 9, late dining on Friday and Saturday. Soundbites Grill has some of the best views of the Sedona Red Rocks. Offers world-class entertainment, food, fun, and music.
Two things we can count on every year:
a new set of tax rules and great weather here in northern Arizona.
Jackson Hewitt Tax Service, locally owned and operated by Lewis Rice since 1997, is here for you all year long.
Your neighborhood Jackson Hewitt Tax Office will help you in all of your taxing situations.
Electronic filing is always free with your tax preparation at Jackson Hewitt Tax Service.
Get more in return. Call 1-800-234-1040 for an office near you.
Show your customers how much they matter to you. Follow up with a real card in just 60 seconds with Send Out Cards. Send Out Cards makes it easy for busy professionals to leave a memorable impression. Stay in touch with a simple one-step process from your phone or computer to their mailbox. Call Judy today at 928-202-2557. That's 928-202-2557.
Breakthrough Medicine's Dr. Shada Sina offers comprehensive hormone testing and customized hormone therapy with a focus on lifestyle medicine, weight loss, allergy drops, brain and digestive health, seasonal detox, and nutrition. Dr. Sina is a referral physician for Suzanne Summers, specializing in bioidentical hormones for men and women. Breakthrough Medicine is located in Cottonwood's Hot Yoga Plaza. Call for a 15-minute complimentary new patient consultation. 928-646
649-0269 or visit online at breakthrough-medicine.com.
Feng Shui artistry, the oldest form of development planning, today known as the art of placement. For 26 years, master Feng Shui educator, practitioner, artist, and author Caroline Patrick Bournet has used ancient rules of environmental, physical, and spiritual harmony to support clients' health, knowledge, creativity, and success. In mapping your home, you'll understand yourself. Better living is the gift of a lifetime. Change your life one room at a time. Schedule your Home Therapy 101 consultation today.
Welcome back to Health, Wealth, and Happiness. We're talking with Dr. Jack Huston. He's from Camp Verde Eye Care. We've been talking about, oh, there's so much information, and we could keep going. We really could. There's so much to know about eyes, and I'm just amazed at the amount of knowledge in your brain. You're incredible. But let's really hit home the importance of a yearly eye exam.
Yeah, the main thing is, you think the eye exam is about getting new glasses, and it is, but the fact is that we're looking at your health through your eyes. And the condition of the eye in particular, but even other health problems, and also any things that are changing too rapidly. So, if we can keep track of it on a yearly basis. Now, if it's a younger person and they've been in 3 or 4 times, I might stretch it out, but a younger person, when they're growing, also changes more rapidly as far as their glasses are concerned.
Right.
But as we get older, especially, there are more things that can happen, and the quicker we catch them, the quicker we can stop them from getting worse.
That is true. If something is going on, you certainly don't want to wait and let it get further along, and then it gets harder to treat. And now you can diagnose things so early that a simple eye exam, even if you say, I see great, what do I need an eye exam for? I'm fine, I don't have dry eye, everything's good. You still should go.
There's an interesting thing we get frequently. Somebody comes in and says, I see some flashing lights and stuff, and you ask them a lot of this is asking the right questions. People have ocular migraines and never get a headache.
Oh.
And that's one of those things.
That's what that is.
Yeah.
Oh, ocular migraines.
A lot of people that get a migraine know they're going to get one because they have that phenomenon going on, but that can take all kinds of. You can even lose vision completely off to one side, and it can come back with a migraine. Wow. I even have had a couple that I knew were going to get multiple sclerosis from something that happened.
Wow.
And we had to send them for an MRI to prove it, and then there's really not too much yet they can do about it.
Oh my gosh. That's crazy. I want an appointment with you.
Okay.
I'm going to call.
3330.
3330. 928-567-3330. That is the number to call if you want to get involved. If you're a new patient, doesn't matter. If you want to transfer over, doesn't matter. You can also go to cv-eyecare.com for all your eye care needs. You want to check him out. Dr. Jack Huston, thank you for being here.
Thank you.
We could keep talking. You're so fascinating. Now I'm like, we're all interested in all these different eye things.
My wife and my help say I talk too much.
You talk too much. I say no way. I think you're awesome. Thank you very much for being on the show today.
Thank you for having me.
That's all the time we have for Health, Wealth, and Happiness. See you again next time.